Hi team, Luke Margolis, Corporate Communications Director here for Atlantic Health, and I'm excited today to be joined by Dr. Don Allegra. He is an infectious disease specialist with us here at Atlantic Health System, and we're here to talk about something really important, not just the current state of play as it relates to COVID-19, but also the latest news that we're seeing now, which seems to be changing all the time, on variants, boosters, third doses, all sorts of changing circumstances here. And Dr. Allegra, why don't we start first for our team and give them a little bit of a, I guess you call it the state of play, maybe, on where we are with COVID-19 and what we're seeing nationwide, in New Jersey and even nationwide, if we want to share some of those facts as well.
Well, starting in this summer, around July 4th, remember we were talking about coming out of this and we weren't going to have a problem with COVID anymore, opening the country, the big celebration on July 4th. Mm-hmm. But over the last 6 to 8 weeks, we've had a spread of the Delta variant, which started in India, and it was less than 1% of all of our cases initially, but now it's well over 90%.
So it's the dominant.
It's the dominant strain. Yep. And the Delta variant appears to be much more contagious than the original variants we had, where each person who gets infected infects 8 or 9 others, where the earlier variants just had 2 to 3 that would be infected. So it's much more transmissible. And we don't know whether it's any more serious than the earlier variants, but it does seem to be spreading like wildfire. And I know in my personal experience, when I have one case in a family, almost everybody is infected now, while before there would be isolated cases in families.
What's been the practical effect then in terms of more patients, more folks needing care and hospitalization?
Well, we've gone, in the Atlantic Health System, we've gone from under 10 patients 6 weeks ago to nearly 70 patients hospitalized. In New Jersey, we've gone from about 200 cases a day up to about 1,800 cases a day. And as far as where we are as a state, because we have a fairly good vaccination level, we are 43rd out of 50 states in terms of the level of cases. And the cases where there are very low vaccination rates, like Mississippi, mm-hmm. have very, very high hospitalizations rates, where in some of these states there's no more ICU beds even. So we're not at that point yet, but it's sort of the law of mathematics. If you start at a very low level and keep on doubling the cases, you're eventually going to get to a number that's really very significant.
1 to 1, 2, 2 to 2, 4, et cetera, et cetera.
Exactly.
I know that some of the things that we've talked about that will help us in this fight against this virus remain consistent: masking, social distancing, but vaccination and the rates we're seeing. Talk, I guess, if you're willing to, a little bit about where we are as a system in terms of vaccinations and how valuable those have been in our efforts to combat this virus.
Well, I think we've done a good job in trying to educate our staff, and we are at 85% of our staff being vaccinated, which is really quite high, and higher than a lot of places that are even fully vaccinating, mm-hmm. Mandating vaccination. But we really like it to be closer to 100%, because there's very few contraindications to this vaccination. Most of the societies, even the OBGYN societies, are now fully recommending, even for pregnant women, that they be vaccinated, because it's been shown to be very safe in pregnancy, not have any effect on the fetus at all. So part of our efforts now is to try to convince that other 15% who are now being tested on a regular basis, but there's nothing short of vaccination that is really protective. If you look at the numbers for our country, we have about 94 million people who are not vaccinated at all, well over 150 million that are fully vaccinated. And if you look at the hospitalizations, 97% of the hospitalizations are in those who are unvaccinated, and 99% of the deaths. So this is huge numbers of people. It's quite clear that vaccination is protective. We are starting to see some breakthrough infections, true.
Yeah, you're hearing about breakthrough cases.
In the vaccinated, but most of those infections tend to be relatively mild. And oftentimes those patients are not hospitalized, and it's more of a mild to moderate disease. We are now getting into the thought that maybe we should be given a third dose of vaccine. And I think that's sort of an evolution now, but the data coming out of Israel, where they vaccinated very early on, and they're more than 8 months out for much of their population, they're showing that they're starting to have more and more breakthrough infections. And though most of them are mild to moderate, we're still concerned about getting ahead of the curve and not have the same process happen in the United States. Or maybe there's waning immunity with time, and that we need a booster on top of that to get you up to full protection.
So we talked a little bit about the efficacy of the vaccines, the safety of the vaccines. As you mentioned, we've administered more than 100 million doses across the country, but worldwide, certainly many more than that. What do we know at this point about the safety of this vaccine as it relates to any other type of medication or vaccine we might administer?
Well, the first thing I'd like to say is that, we have to think about the historical context of vaccines. This is not the first time we've had to play this game. We've had vaccinations for 250 years in the United States. And each time a new vaccine comes out, there's the same reluctance to get vaccinated. But when you really look at the history of vaccines, it appears that we never get rid of infections or outbreaks until people are vaccinated. If you look at polio in the 1950s, parents were keeping their children home from parties because they were afraid of them getting polio. We got the vaccine in 1955, and over the next few years, we eliminated polio in the United States. Smallpox has been totally eliminated in the United States. Even in Washington, George Washington's time, he had trouble vaccinating the Continental Army, and eventually it was mandated, and some historians think that our success in the Battle of Yorktown in the Revolutionary War is directly related to the fact that our troops were vaccinated at the time. So thinking about it that way, most of the side effects of vaccine are in the first 4 to 6 weeks. So we are really months down from 4 to 6 weeks. And as you mentioned, around the world, probably 2 to 3 billion people have gotten at least one dose of one of the vaccines that is available in the United States, either J&J or the Moderna or the Pfizer vaccine. And of those people, sure, there have been side effects now and then. But just remember, things like strokes and blood clotting and so on, there's a certain low level of that in the population anyway. If you give 100 million people a vaccine, some people are going to have strokes and heart attacks, et cetera, in the next month after that, just by the law of averages. And the other thing is that COVID is associated with that too. That if you get COVID, you have a much higher incidence of things like lung clots and clots in your legs and strokes and problems with the heart and so on and so forth. So looking at it all, sure, there have been some side effects, but they've been very, very minimal, very rare in fact. There's only been a couple of deaths related to side effects related to the vaccines compared to the 650,000 that we've had in people in the United States who have gotten the disease.
Labor Day is coming up. It's a time where a lot of folks enjoy each other's company outside and together in groups. What would be, as we talk about ensuring that our team enjoy their time safely and do what they can to protect themselves, what's your recommendations for the best tips for ways that our team members can keep themselves safe for Labor Day and beyond, for that matter?
Yeah, I think that everyone's concerned about the messaging that has gone on, and people, the CDC keeps changing their tune every couple of weeks. But I think over the last 4 to 6 weeks, things really have changed. This Delta variant is a real threat. And I think that has changed the whole equation about what we should be doing. We were talking about opening up the country and people with who have been vaccinated not wearing masks and so on. But it's pretty clear now that this new variant is so contagious that now that if you are indoors, whether you're going to an indoor celebration or wedding or whatever it is, that you really should be wearing a mask, even if you're vaccinated. And you probably should not be eating very close to other people who are, don't have a mask on either. So I think the whole ball game has changed. And I think that we're learning that in New York City, for example, they're not allowing you to go to any Broadway plays unless you have your vaccine status is established as being vaccinated, or unless you've been tested within the last 72 hours and been negative. So I think the equation has changed recently, and I'd be very cautious about getting together in big groups. I think if you have a family that has all been vaccinated and you're going to have a small celebration around Labor Day, to answer your question, I think that would be reasonable. And I think, all risk is relative. I mean, getting together with 50 other people is more dangerous than getting together with 4 other people.
Sure, that makes sense. Dr. Allegra, thank you so much for talking to us today. Folks, if you have any questions at all, feel free to, we're going to post this video. You may be seeing it on the Compass, or perhaps you're seeing it on Workplace. I would encourage you to, if you have any questions, put them in the chat thread right there in the video, and we'll do our best to get you connected either with Dr. Allegra or any other member of our team who might be able to help you get answers to your questions. Certainly, please stay safe out there. And Dr. Allegra, thank you so much for sharing this really important information with us today.
You're welcome.
All right, folks, we'll see you next time.